Hello, colleagues and friends. Today we're going to talk about a very important topic, in my opinion, which is lights and shadows in rhinoplasty. You're going to listen to me talking about this in very different situations, in different lectures, because we're going to use this. Today I'm going to give you a basic concept just for you to start understanding how important it is. But then we're going to cover that again when I teach you how to take pictures in your studio, how to take beautiful pictures and videos in the operating room so you can share in your Instagram and social media. So today let's go with the basics. And when we talk about lights and shadows, it's so important because, example, if I'm here with you and you're looking to my face, and if I have lights only on this side, you're going to see a shadow on this side, or the opposite here. Or if I have just a light on my back and I have shadow on my face, so everything changes with lights and shadows. And why we talk about this in rhinoplasty? Because first, patients take pictures and they have different lights and shadows and they see themselves in a different way than you see. Second, when you're doing a rhinoplasty, whatever you do inside, you are affecting the lights and shadows of the nose because everything has to do with structure. If you put volume on a place, you're going to have highlights. If you remove volume, you're going to have shadows. So imagine that you have a tip without definition. To have definition, you need to stretch this skin out so you have definition in lights. But to do that, you have to have strength in your cartilage grafts. So let's take a look here and have some basic concepts in your practice. Well, why I'm showing here a body? Because as a plastic surgeon, we're trained to give more definition or less definition in surgeries like body contour. And when we do this in body contour, we are designing the shadows in the tummy tuck or the abdomen of this patient. And how we do this, or how we can think about that when you're doing a rhinoplasty, and why not? Sometimes the patient can come to you and say, okay, doctor, I want a more defined tip. I want a less defined tip. So you have to adjust that. So there are some secrets of lights and shadows here just to show this patient when we change lights and shadows, how you can change the color, how you can change the way you see the contour of the nose. And lights and shadows means that when you have this patient with a very crooked nose, and then I tell you that this patient was only makeup. So she didn't have a crooked nose. Because with makeup, you're creating highlights, you're creating shadows, and when you put shadows, you were giving an idea that you're decreasing volume. When you put lights, you're giving an idea that you're creating volume, and that's what a professional a professional person did on this patient doing her makeup and creating this deviation. So why makeup? Because makeup can make people more beautiful, especially if it's well done. Of course, you can create this definition on the tip and you can really change faces. So take a look on this patient here. So it's the same patient, but it doesn't look like the same patient. And here the same thing. So definitely this patient is more beautiful with the makeup. This patient, I operated myself. I did this surgery in 2013. And on that time, she had a deviation of the axis. And when I opened this nose, I did this surgery. Look at the result that I had back in 2013. I can see here a little inverted V deformity because I couldn't adjust and correct her nasal bone deviation that she had there, especially on the right side. And the tip was better, but not the way I like it. So you can see here, what I did on this patient was I created a little shadow around her tip, just like in a Google picture, it teaches me not to do with makeup. So what I should have done was this, but I did it wrong. So why that? Because I have to understand what's happening, so then I can improve myself. And to improve myself, I did courses. I took sculpture lessons, I took makeup lessons, and I took also drawing lessons. And here, just an example, with makeup, look what can happen with me. Only with makeup, she could reproduce a straight nose or a crooked nose. So only doing makeup on my nose. Here, drawing lessons to improve my knowledge in lights and shadows of the nose and how to draw it. And when I draw it, I start thinking on the structures under the skin. So imagine the professional person who does makeup, they don't know what is under the skin. You as a surgeon, you know what is under the skin. So you can imagine while you were doing the surgery, why you're doing that and how you can do that to improve the tip contour or the dorsal contour. Well, this article is very important because the interviewee on this article, he said, when contouring the nasal tip, the surgeon should focus more on creating favorable shadows and highlights and less on narrowing. So don't remove structures, but position in a way that you have better highlights and shadows. Nasal tips contoured in this manner will look more natural and will better withstand the forces of scar contracture that can negatively affect rhinoplasty outcomes in long term. So that's the way you have to focus, not removing and resecting structure, but reposition. So this concept is very important because instead of removing the cartilage the way you learn and the way I learned that you have to resect the cephalic portion and leave like 5-8 millimeters. So that's the cake recipe that we all learn. So instead of doing that, try to remodeling this cartilage. And one way to do that is this tip suture. When you do this tip suture in this way, you can create the eversion of the caudal border, and you can make lower the cephalic border. So you can do this with your cartilage, okay? You can do this, creating lights here and shadow here on the resting angle. Caudal border with lights, cephalic border with shadows. And that's what we did here on this patient. So we want to create a cartilage with minimal resection, but we can create tip defining points here on the highlights, a straight cartilage, and a better definition. So that's not what I could achieve on this patient back in 2013. So I had to do a surgery on her to improve that. So what can cause this deformity? This deformity, like we say, parenthesis deformity, is lack of support on the caudal border. And lack of support on the caudal border creates shadow. And if creates shadow, it's not a pleasant tip the way we discussed it. And instead of that, we can create tip defining points here, better caudal margin, and better resting angle in our reconstruction. And we can improve the tip, we can improve the dorsum, and definitely this patient will be better. This is another patient. I did her surgery. Also, when I opened, the cartilage was very malpositioned and not in a pleasant way. I did this structure on that time more than 10 years ago, and of course she was not good. Okay, so I have the pinched tip, parenthesis deformity, retraction of the alar margin because she already had the problem, but I could make it a little bit worse, and she was still complaining about the little ball on her tip, and then I had to revise this patient again. So the same mistake that I had back there, and I hope you that is watching this lecture don't have the same mistake that I did more than 10 years ago, and that's the purpose of the mentoring. Okay. After that, I did a revision on this patient. I did the structure, and I could improve the tip and the highlights as well. So that you can transport to dorsal lines and tip definitions, but I'm going to talk very specifically on that, how to gain better dorsostatic lines and better tip definition in another lecture.